Welcome to the happiness game, where these RNs in training are going to test their knowledge on teen depression screening. All right, let's get on with it. The happiness game. Let's meet our contestants and what makes them happy.
Hi, I'm Allison, and ice cream makes me happy.
Yay!
Hi, I'm Tana, and going to the beach makes me happy.
Great.
Hi, I'm Chad, and I don't want to be here.
Oh, that's awesome. All right, let's get started. Why don't we? Our categories, let me introduce them. Our screening, adherence and benefits, the health belief model, and the CNL role. Okay, Allison, you're first up. Go ahead, pick your category.
I'll take screening for 100 happiness points.
For 100 happiness points, what is grade B?
Ding ding!
Yes.
What is the USPSTF depression screening recommendation for adolescents aged 12 to 18?
That is correct. 100 happiness points to Allison. All right, you get to pick the next question.
Okay, I'll stick with screening for 200 points.
Okay, let's see what we got. Patient Health Questionnaire for Adolescents, or the PHQA, or the Beck Depression Inventory Primary Care Version, BDIPC, done on an annual basis.
Ding, 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 ding.
Yes, Tana.
What are the procedures and time frame for depression screening for adolescents?
Yes, 200 happiness points to Tana. Awesome job.
Yay.
Okay. So you get to pick the next category.
I'll go ahead and have adherence and benefits for 100 happiness points.
Excellent. All right. Decrease in suicide risk, healthcare costs, hospitalizations, early pregnancies, physical illness, and substance abuse. Increase in school performance and social functioning.
I know.
Oh, okay. Chad.
What is morbidity, mortality, and benefits from depression screenings in adolescents?
That is, let me ask our judges. That is correct. You get 100 happiness points, and cool. Chad is in the game. That's awesome. Yes. All right, Chad, you get to pick the next question.
Awesome, cool. Can I do adherence and benefits for 200 points?
Yeah, let's see what we got. Inadequate time, reimbursements, lack of resources, training, provider shortages.
Ding ding!
Yes, Allison.
What are barriers to provider adherence?
That is correct. 200 points.
All right.
All right, I think you're in the lead. Go ahead, Allison. Go ahead and pick the next question.
Okay, I'll take adherence and benefits for 300 happiness points.
Okay, what do we got? Work/school, lack of transportation, insurance provider, office hours, stigma, parent involvement.
Ding, 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 ding.
All right, Tana.
What are barriers to patient adherence?
That is correct for 300 happiness points.
Ooh.
Yeah. Okay, and you get to pick.
I'll go ahead and take adherence and benefits for 400 happiness points.
SSRI treatment can increase risk of suicide and risk of unipolar depression, becoming a bipolar disorder. Okay, let's put our thinking caps on.
I think I know. Is it limits to screening?
Yes, it is.
Oh,
400 happiness points. Awesome job. That is so good. I think, Chad, you might be in the lead. Okay, so you get to pick. You get to choose.
Sure. Can I do adherence and benefits for 500?
Okay, let's see. 500 happiness points, 37% of females, and 25% of males.
Ding ding!
Yes, Allison.
What is the prevalence of adherence to the screening based on patient report?
Yes, Allison, you earned 500 happiness points.
All
and
right.
I think now Allison is in the lead. Sorry, Chad. Okay, and you get to go ahead and pick our next question.
Let's do health belief model / CNL role for 100 happiness points.
Perceived severity, perceived susceptibility, perceived benefits, barriers, modifying variables, cues to action, and self-efficacy.
Ding, 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 ding.
Yes, Tana.
What are types of risk factors that influence adherence per the health belief model?
Correct. That's 100 happiness points. And, yeah. Is that the one where I say, sorry, I messed that one up. Let's keep going. Okay, yes, you got that right. You got that right. Okay, and you get to pick the next category.
Can I take health belief model and the CNL role for 200 points, please?
Absolutely. Okay, education regarding severity, consequences, prevalence, decrease mental health stigma, provide access to online screening tools, inform patients, that screening is easy and painless, and get you treatment, reminder calls and emails, public outreach, provide privacy and encouragement, and decrease stress.
Ding, ding, ding.
Yes, Chad.
Ding. What are ways that CNL can improve adherence among patients?
That is correct
Yes.
for 200 points. And that is correct because they all relate back to the health belief model.
Ooh.
Awesome job. Okay, you get to pick the next question.
Sure. Okay. Can I do 300 for the health belief model and CNL role?
Absolutely. Okay. Advocate for better mental health care coverage, promote school-based mental health centers, educate providers, easy, fast ways to screen, collaborate with mental health specialists, respecting autonomy, interviewing teens alone.
Ding, ding. What is hot sauce?
That is, let me check with the judges. That is incorrect.
What?
Well, ding ding.
Yes, Allison?
What are things that CNL can do to improve adherence among providers?
That is correct for 300 happiness points. All right, everybody. Okay, the good news is we have our last and final question, and sometimes this one is a daily double. So, Chad, even though you're losing, even though you're... you can still win. You can still win the happiness game. All right, so here we go. The very last question, let's see, with the daily double, and it is! Okay, all right, all of you got the chance to win the happiness game. All right, here we go. Ensure that diagnostic tools, adequate treatment, and follow-up systems are in place.
Ding, 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 ding.
All right, it is Tana for the game.
What are ways to enhance population-based screening?
Yes, because we know the grade B recommendation only applies when systems are in place to ensure adequate screening and treatment and follow-up. So Tana, you're our winner. Congratulations! Yay!